Good afternoon. I'm Judd Mellinger Block. I'm the director of the Pennsylvania Primary Care Career Center. And I'm here today with Angela Luther, FNP, a family nurse practitioner, CRNP at Primary Health Network in Beaver Falls, Pennsylvania.
Mhm.
And Angela is a graduate of, has her BSN from Robert Morris University in Moon Township, right outside of Pittsburgh. And after a career working of about nine to 10 years working in outpatient hemodialysis in a variety of positions, and, including managing and also education, she went back to school and now has her FNP from Walden University and has taken a job with Primary Health Network. And Angela, Angie, that's in the Beaver Falls practice. Is that correct?
Well, I'm currently up at the Newcastle location.
Oh, the Newcastle location.
Yes, sir.
Okay. All right. Excellent. Excellent. So welcome. Good to have you
Thank
here.
you. It's nice to be here.
Good. Thanks for taking some time to talk with us. So
Mhm.
tell us a little bit about your background, Angie, where you grew up, any kind of family influences or community or teachers who influenced your career, anything along that line that you feel comfortable sharing.
Well, I grew up in Wilkes-Barre, Pennsylvania. It's out in Northeast PA. And I think as far as my biggest influence would be my mom. My mother was a registered nurse, and she did nursing forever. And I always remember being very intrigued on what she did. And I feel that I want to say regulations were a little bit looser back then, but I remember being on the floor with her, and I remember being able from a distance watching a doctor place a PICC line on a patient when I was maybe 5 or 6. I just thought it was the coolest thing in the world. So I really wanted to get into the healthcare field. And she also was in dialysis, and I always had a very good, I just thought it was really cool with the machines and seeing how, this can keep people alive when their kidneys stopped working. So I thought, well, if that's just one piece of it, what can you do further? So just decided to get into that. And then in dialysis, seeing so many people that came to us not knowing that their kidneys didn't work and not knowing they were sick. Because with renal failure, a lot of time you don't know until your kidneys aren't functioning appropriately to sustain life. So I thought, how many people in the primary setting don't know that they're ill or haven't had testing? So that really pushed me to go back for my master's and get my nurse practitioner to specifically work in the primary setting to just really help with health promotion and monitoring and screening and things like that.
Yeah, because I imagine the best hemodialysis treatment is to avoid hemodialysis altogether.
Absolutely.
Right.
It's very time consuming for patients. It's very hard. It's devastating on patients and on their families. And to not get to that point obviously is the ultimate goal. But I mean, if people need it, it's there and it's a wonderful treatment. But so much can be done with preventative measures and proper management of blood pressure and diabetes. And I wanted to be a part of that, to not have people get to the point where they need dialysis or need transplants.
Right. So when you decided to go back and get your FNP and do all that, what were some of the barriers you had to overcome to reach that goal? And conversely, what are some of the positive things that happened, some of the factors in your life that made it possible?
Factors that made it possible was support. I had amazing support through my husband, through my parents. My job was extremely supportive. I had stepped down to a staff nurse again to allow a little bit more flexibility for class time and clinical times. So just having a lot of people around me that really wanted me to succeed, both professionally and personally, I wouldn't have been able to do it without them. Barriers, I had 2 children at the time, both younger, and after I registered for my first class, found out I was pregnant with my third.
Oh, my word.
So going to school and working and being pregnant was definitely a challenge, but took time off here and there as I needed to. But it was different. I know a lot of people aren't really big on the online format and the online schooling. I think quality of practitioners that they're graduating is definitely a concern, but it was nice to have that option to do online, to do it at my pace at 9, 10, 11 o'clock at night when everybody was sleeping. And I can definitely say that it wasn't a walk in the park. It wasn't easy. Classwork was very difficult.
Right.
But So I think a little bit about that. It was nice to have options, but just life makes it a little bit challenging at times.
Hmm. Absolutely, absolutely. So, what caused you to want to work for Primary Health Network?
Well, I was very fortunate to do two of my clinical rotations with Primary Health Network. Since I focused specifically in family nurse practitioner, we had two kind of like primary settings. Our very first clinical was in primary care. Then we did, excuse me, an OB and a pediatrics. And then our last one was kind of like an advanced primary care to really culminate all that information and all that you learned to kind of
Mhm.
phase out of it. And I did my first rotation up at Sharon with a fantastic nurse practitioner with Rick Humphreys up there. And that really got me into PHN to see how they did things, even from human resources and how easily everything. I
Mhm.
just thought it was a great organization overall. And then I was fortunate to do my I'm sorry, my second one here at the Newcastle location with one of their physicians. And again, it was a great experience knowing the staff and seeing what kind of challenges this specific patient population kind of has based on the
Mhm.
demographic. And that's when there was an opening at this location in my clinical rotation. So I applied and we kind of went from there.
That's great. That's great. So, how would you say your personal life philosophy has led you to this point in your career, working in primary care and working with a lot of underserved folks?
Personal philosophy, I feel health promotion is a really big piece of it, health education. I'm very much about preventative medicine and kind of a proactive rather than a reactive. And I feel in general, just having people to help educate and so they can have their own tools and the knowledge or resources of what they can do and what they can utilize to, help maximize their health.
Mm.
I know this particular area is a little bit tough when we think about access to care, whether it's transportation or finances and things like that. So sometimes we don't get patients that always follow up with their appointments the way that we would like them to.
Right.
They can't necessarily afford medications and they have to sometimes choose which is more important versus the other. So I feel if, a lot of lifestyle is really pushed as far as exercise and diet and what things to do, what things to not do, warning signs, what to look out for, to kind of help get them through that. And obviously, helping with them with the resources, whether it's through recommendations for insurances, try to help them with that, with the
Mhm.
support that they need. It's challenging, but it's very rewarding when you kind of you can tell that you can reach that patient to make a difference, and it's just great when you see people really, really thrive.
Nice, nice. Yeah, you've already kind of touched on this a little bit, but I would think that your work in hemodialysis, working with chronically ill, acutely ill people, um, really gives you some maybe a different perspective than somebody else coming straight out of school or somebody who hasn't worked in that area. Do you feel like you have a different outlook on those sort of conditions?
I don't know. I think maybe a different perspective, but not necessarily a different level of importance because obviously, all advanced practice nurses have their own unique niche. So you might have someone that's come from cardiac or the ICU or the
Right.
emergency room. Everybody kind of, I think, has that one little thing that helps drive them. Like I said, for me, I think a big thing with dialysis is really focusing on, again, like blood pressure and diabetes and helping understand having patients understand the implications of those uncontrolled numbers that they might not feel bad but the damage is being done to their body
Right.
if they don't do what they need to do. So I think it just gives us a little bit of I think a different focus of what I have. But obviously regardless, I think the I don't want to speak for everybody, but I really think that a lot of
Sure.
people, especially nurse practitioners, have that nursing background. So it's a little bit different than like the physician of
Mhm.
how we look at things. So I think
Sure.
again, health promotion is a big piece of it.
Great, great. So is there anything that now you did a couple rotations at Primary Health Network, so maybe you can, even refer back to when you were still a student. Is there anything about working at Primary Health Network and working in FQHC that surprised you, that you didn't, that was different than you thought it would be?
I don't know. I mean, I know with doing my clinical rotations, I got to see how much not only do the physicians and the nurse practitioners and the PAs, really obviously care about the quality of their patients and how their health is. But I mean, that goes down to the pharmacy that's here, the MOAs, the LPNs, the front office staff, and I got to see that as a culmination, and having that kind of camaraderie of really wanting the best outlook for the patients, I think is definitely great. I wasn't surprised by a lot of the challenges given the social area. One of my dialysis clinics was inner city Pittsburgh.
Okay.
And a lot of the challenges that I personally had down there with, again, access to care, rides, health education, things like that, are not far off from some of the challenges that we have up here. So that it just kind of was very reminiscent of my earlier days in dialysis. So it's just a little bit of a different spin on it.
Right. So if you're going to talk to a group of nurse practitioners and tell them what they need to know about working in a community health center, what would you tell them?
Be flexible and be ready for anything.
Right.
Be patient, take things with a grain of salt. I think that our patients really have a lot of challenges that there's reasons why they're not compliant. It's not just like, oh, they're not doing what they should be doing. Get to the root cause of it, really find out what the why is behind it. Sometimes you have to be firm. Sometimes you do have to, I don't want to say put your foot down, but there's a little bit of tough love that's
Sure.
incorporated to as well. But, have grace, have an open mind, but still be very kind of steadfast in your belief, and, focus back a lot on that pathophysiology, a lot of education to patients.
Right. Right. Yeah. I like the word you use, grace. And sometimes grace there's such a thing as tough grace.
Yeah.
Yeah. Yeah. So is there any patient or group of patients that in your mind stand out as I don't know, as kind of an example of the benefits of working in a community health center, or the challenges you face on a day-to-day basis, or anybody you can call up? I mean, keeping HIPAA compliant, of course, but anybody that comes to mind?
There's two, I mean, a lot of them, but there's two
Sure.
general groups that I think of. One is our patients that have a psychiatric history. There's a lot of, mood disorder, depression, anxiety, and sometimes if you can help either get that under control or get them in with the right resources, that really affects how the rest of their medical care goes. Because if they're not in the right mindset to follow through and do what they need to do for their overall health, you're just spinning your wheels. So sometimes you really have to address that psychiatric need. The other one I would say are parents with younger children. We have sometimes difficulty with kids getting to appointments when they need to, or education to parents based on how often to feed infants, what type of formula, not giving 6 months old soda to drink. There's a lot of education that really goes into there, and just again, offering the good support and make sure that parents and children know that the doctor's office is a safe places that they can be honest about what's going on. Both, again, parents, sometimes we have grandparents, we have foster parents that bring kiddos in, being
Sure.
open and honest. So that way we can, do what we need to do and provide the best health that we can, for these kiddos. And again, if you educate these parents, they might walk out of there with a bit of information that they didn't know prior, which can really make a difference on the growth, the development, or even the safety of that child going forward.
That's great. That's great. So anything else you want to add about working in primary care, working in an FQHC, anything like that?
I would probably say it's one of the most frustrating, yet one of the most rewarding things that you can do.
Yeah.
I didn't come into this setting thinking it was going to be a walk in the park. So it definitely challenges your knowledge. It challenges sometimes your patience, but I absolutely love it. And I think that if you really have a calling to work with this type of population, to work with an FQHC, you can really make a difference with one of the hardest populations to reach. And not every story is a success story. You're not going to
Right.
get through to everybody, but you really have to embrace and really just kind of hold on to when you do make that difference, because you will have these patients that come and say, I wouldn't have been alive if it wasn't for you.
Wow.
And that means some of the biggest things in the world. Now, obviously, we try to do the best and be life-changing for as many patients as we can, but just, like I said, just keep at it and just keep the passion. Don't let it, beat you down.
Great. Great. Well, Angie, thank you so much for taking some time with us, and thank you for all you do at Primary Health Network and doing in your community. And have a
Yeah,
great.
thank you very much. The same to you. Thanks for having me.
Thank you. There we go. Okay.